Okay, welcome back again. We studied about what is posterior triangle, where it is located, what are the boundaries. We studied about anterior border, posterior border, inferior border or the base, apex, and roof and the floor. Okay, now we are going to study about the contents. What are the contents of the posterior triangle? Now, what are the main important contents? What did we do? See this picture. This is a very beautiful picture actually. This is pictures given in Keith and Moore uh, textbook, Clinical Anatomy by Keith Moore. Very beautiful pictures, dissection pictures. This is pre-vertebral layer. You can see the floor muscles. See here, semispinalis capitis, splenius capitis, levator scapulae. See, most of the time we see triangle only from here to here. This part we actually miss because what happens in during cadaveric dissections, this part is shorter. Okay, we cannot extend beyond. We'll have to turn backside, and from backside onwards, we'll need to dissect. If you are interested in during dissection time, you can see back dissection also. You can reflect the skin, see the trapezius muscle, reflect it, then you see these muscles also. Okay, you can see them. Semispinalis capitis, splenius capitis, levator scapulae, big muscle. Then comes this scalenus anterior and scalenus medius. These two muscles are present. Okay, now deep to trapezius you see scalenus posterior. Okay, so these are the floor muscles. Now what I'm doing, I'm seeing at the contents. How I can see contents? I reflect the uh, prevertebral fascia, then I can see the contents. What are the contents? Let's see. Entire triangle is divided into two parts again. We'll go back, little bit back. Okay, yes, this picture. See here, this is the posterior triangle. Entire triangle is divided into two semi-triangles. Okay, this upper part and this smaller lower part. Okay, by what? By a muscle. This muscle is called as omohyoid. Okay, omo refers to the scapula, hyoid refers to the hyoid bone. Okay, this muscle is coming from scapula. Scapula is deep here. Okay, we cannot see scapula here. This is clavicle. This muscle has got two bellies. Two bellies means two tummies. Okay, two stomachs, two bellies. These are called as two bellies, muscle bellies. So this is the superior belly and this is the inferior belly. Inferior belly of omohyoid divides the posterior triangle into two triangles. Okay, what are the two triangles? This is called as occipital triangle. Okay, occipital triangle, and the lower part is called as supraclavicular triangle. Okay, or it is also called as subclavian triangle. Occipital triangle and supraclavicular triangle. So these are the two parts of posterior triangle. In your textbook, nicely the demarcation is given. The contents are given separately for these two triangles. But what we are going to do now, we are going to study all the contents of these two triangles together. Okay. What are the contents? Let's see. These four cutaneous nerves, actually these are coming from deep to superficial, right? So they are actually the contents of the posterior triangle. They enter into the roof. Okay, so what are the four cutaneous nerves? We get lesser occipital nerve here, great auricular, okay, transverse cervical cutaneous, and this is the supraclavicular. What did we do? We picked out all these nerves, kept them aside. Okay, so that they are not disturbing rest of the structures. This is how we will do in dissection hall also. Then external jugular vein. I don't need external jugular vein because that can obstruct my view to the contents of the posterior triangle. So what I'll do, I'll make a cut of external jugular vein. I cut down here, you can see that, removed it off. Then we will see prevertebral fascia, clear out the prevertebral fascia, then we can see the nerves and contents. What are the main contents? Let's see. Other than these four cutaneous nerves, the most important content is spinal accessory nerve. Okay, what is it? Spinal accessory nerve. spinal accessory nerve. It's not accessory nerve. Accessory nerve is 11th cranial nerve. Okay. What is it? 11th cranial nerve. How many cranial nerves do we have? Anyone?
11 pairs.
Hmm?
11 pairs.
11 pairs or 12 pairs?
12 pairs.
12 pairs, sorry.
12 pairs of cranial nerves are there, right? So 12 pairs of cranial nerves are there, and this is which one? The 11th one. Okay, 11th cranial nerve, which is called as accessory nerve. Now accessory nerve has got two parts, cranial part and spinal part. Okay, cranial part is going deeper inside. When we are doing anterior triangle, we'll study that. This is the spinal part. Spinal part of accessory nerve is purely motor. What do you mean by motor? Can anyone tell me what is motor?
It carries senses from the central nervous system to the muscle.
Excellent. Okay, for the muscle contraction, the information is coming from the center to the muscles. Okay, motor nerve. So accessory spinal part of accessory nerve is purely motor. Okay, it supplies to the sternocleidomastoid muscle and the trapezius. Okay, these two muscles are supplied by the spinal accessory nerve. Okay, very important nerve, and you are supposed to find it in the dissection hall. This is the key content of the posterior triangle. Okay, other than the spinal accessory nerve, what are the other nerves we can see in the posterior triangle? See here, there is one nerve which is going, this is the levator scapulae muscle. Okay, this nerve is actually piercing the levator scapulae muscle, going deep to it. Okay, this nerve is called as nerve to the levator scapulae. What is this? Nerve to the levator scapulae. How do you find out in the dissection hall? You have to clear the levator scapulae muscle out of deep fascia. You will see the nerve piercing it and supplying it. Okay, so this is a nerve to the levator scapulae. Clear till here, everyone?
Yes, ma'am.
Now there are few nerves which are coming from a bunch of thick nerves which are going to the upper limb. Upper limb means we have arm, forearm and hand. These are the appendages of the body. To supply this entire upper limb, we have thick, big bunch of nerves. We can see that in the dissection hall. Cord-like bunch of nerves. These are called as brachial plexus. What is it called as? Brachial plexus. This brachial plexus has got roots, cords, branches, divisions. Don't worry about that. Luckily, you are not studying upper limb, so you need not study all that. What you have to remember, these only cords of the brachial plexus are present here. Okay, there are three cords of brachial plexus. Okay, lateral, medial and posterior cord of brachial plexus. Don't worry, no one is going to ask you what are the cords. What you have to remember is brachial plexus are present here. From the brachial plexus, some nerves are coming out. Nerve to rhomboids, okay, nerve to serratus anterior, nerve to scalenii muscles. No one will ask you. Just write the name of the nerves. That's it. Okay, in dissection hall it is difficult to find these nerves because they are deeply present to levator scapulae, so we will usually avoid finding these nerves. Okay, if you want to find them out, remove the trapezius, then you can trace the nerves so well. Okay, nerve to rhomboid, scalene. Rhomboid muscles are back muscles. Okay, scalenus is a back muscle. Serratus anterior is a back muscle. So all this you can see only when you remove of trapezius. So these muscles are supplied by the nerves, branches which are coming from the brachial plexus. Okay. Other than these nerves, what are the nerves? How many nerves did we study? See posterior triangle. So many nerves are present. What are the nerves? Four cutaneous nerves. Okay. Spinal accessory nerve, nerve to levator scapulae, nerve to rhomboid, scalenii and serratus anterior, and brachial plexus. Okay, brachial plexus. Other than this, from cervical plexus, no, you get two nerves which are supplying, to sternocleidomastoid and trapezius. But these are not motor nerves. These are sensory nerves. From a muscle, how a sensory nerve is carrying information? Can anyone understand or do know what is sensory innervation to a muscle? Anyone knows that? What is it? No one knows that. Every skeletal muscle has got two types of nerves. One is sensory and one is motor. Motor is for its function. Sensory means what? Sensation of movement. Okay, sensation of movement. We close our eyes, we know that our hand is moving. How this hand is moving, how that sensation of movement is happening, that is called as proprioception. What is it called as? Proprioception. Sense of movement is called as proprioception. So that sensory nerves are going back to the central nervous system, carrying the information from the muscle. How much the muscle is contracting, that information is given back to the central nervous system by these nerves. So that is coming from cervical plexus, C2. Okay? Are you guys following me? Are you
Yes, ma'am.
understanding? Right.
Yes, ma'am.
These nerves are also seen along with spinal accessory nerve. You will see very thin nerves. Okay, most of the times when we are cleaning prevertebral fascia, they are removed off because they are very thin. We don't understand, so they are present, and these run along with spinal accessory nerve. Two nerves are there. Okay, from C2 and C3. So these are the nerves which are supplying, which are present in the posterior triangle. Now let's see blood vessels. Blood vessels are mostly arteries we study. The veins are accompanying the arteries. What are the arteries we will see in posterior triangle? We'll see here at the top, at the apex. Usually this is very difficult to find. Okay, which is very deep. Deep to trapezius, deep to semispinalis capitis. Okay, here they have just mentioned this. Okay, occipital artery. Occipital artery. It is going to the occipital region. This is also a branch of external carotid artery. So this artery we can see here. Okay, this is also a part of occipital triangle. That's why this triangle is named as occipital triangle. So this is the occipital artery. This is also branch of external carotid. Can you say me what are the branches of external carotid? Till now, what did we study? Branches of external carotid.
Posterior auricular artery, occipital artery.
Excellent. Posterior auricular artery and occipital artery. See, occipital artery going to the scalp and supplying it. Okay. So these are the branches of external carotid. Posterior auricular you will see in anterior triangle. In posterior triangle you will see occipital artery. Okay. So that is one of the artery. Then what else we can see? We can see transverse cervical artery. See here, transversely present, which is supplying the neck. Okay, that's why it is called as transverse cervical artery. Okay, this is branch of subclavian artery. We will see when we are doing subclavian artery in detail. So this is a transverse cervical artery. Now if I go to more deep, see here, these are the brachial plexus going to the upper limb. Okay, cord, lateral cord, medial cord, posterior cord, this roots, trunks of the brachial plexus. In posterior triangle, what we will see these regions. Okay, upper trunk, middle trunk, lower trunk. We can see such a big thick nerves. Okay, we can see these trunks in posterior triangle. Now what did I do to show you the trunks? I've cut down the, what is this? Clavicle. Okay, removed the clavicle so that you can see the contents of subclavian triangle, that is the lower part of the posterior triangle. You can see transverse cervical artery, trunks of the brachial plexus, and their branches. Okay, phrenic nerve, right? Phrenic nerve you can see nerve to the subclavius. We'll not discuss this, just the names are important. If you can write down the names, you can write down. Then we will see this big main vessels which are going to the upper limb. Okay, which vessels? Subclavian artery, and below that subclavian vein. Okay, so these are the contents of the lower part of posterior triangle. Clear, all of you? Did you understand?
Yes,
Yes,
ma'am.
ma'am.
So what you are supposed to write in posterior triangle? Boundaries and contents. Contents, at least little bit, 1-2 sentences about each content you will have to write. Okay, main important contents I have already described. Rest of all the contents, names are sufficient. Okay, veins, rest of the veins follow the arteries. Okay, see this just to understand, accessory nerve, 11th cranial nerve. This is the brain stem. We have removed the cranial cavity. This is the bones of the vertebral column. Here you can see accessory nerve. This is the 11th cranial nerve. It has got two parts. This is the cranial part which is coming from the brain stem. This is the spinal part. See here, spinal part which is coming from the upper 2 or 3 parts of the spinal cord, sections of the spinal cord. From there this comes, joins with this cranial part. Then these two nerves come outside together as accessory nerve. After coming out, again they divide. Okay, cranial part enters into anterior triangle, spinal part enters into posterior triangle. Supplies the sternocleidomastoid and trapezius muscle. Okay, everyone clear? Did you understand? Now this is just again lateral view. You can see that accessory nerve is properly formation. This is the cranial part, this is the spinal part. Both of these two join together to form the spinal nerve. Okay, accessory nerve. Accessory nerve, after coming out, immediately it separates into spinal part and cranial part. Okay, cranial part joins with vagus nerve, 10th cranial nerve, and supplies it. Okay, it cannot go directly, it will just join with vagus nerve, and via vagus it will go and supply it. Whereas spinal part of accessory nerve, it is purely motor and supplies to the sternocleidomastoid and trapezius muscle. Okay, this is the spinal part of accessory nerve, supplies the sternocleidomastoid and trapezius. Okay, clear all of you? Did you understand this?
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Any questions? So what is your homework? Okay, right now I'm sending the link for in our Google Classroom. Okay, last session ka Google Classroom ka link also I forgot to send, but I'll send it right now. Okay, so one is we discussed about blood supply to the face, nerve supply to the face. You will have to draw the diagrams and write the short note question and submit. Then you'll have to today's assignment is draw posterior triangle boundaries. One diagram boundaries, next diagram contents. Okay, neat labeled diagrams of boundaries and contents and submit them. Okay, all of you clear?
Yes, ma'am.
Yes, ma'am.